Dr. McCain and her team put together a high level of compassionate care in a non-judgmental and safe environment. Also in the studio is Veronica Kolobab, and she is the clinic's Director of Business Development. So welcome, ladies.
Oh, thank you, Ellen.
It's a pleasure.
Thank you, Ellen.
To have you guys on the show. And we're going to start with Dr. Jessica McCain.
Sure.
My very first question is always the why. What made you want to become a cannabis physician?
Well, it certainly wasn't the direction my medical education sent me. My formal education did not include anything about medical cannabis. And I had the same education that generally the public has, that, cannabis is only illicit drugs. Marijuana is only a recreational drug. And even more so because I grew up in a family of bail bonds. So I knew that there was consequences to drug use.
Yes.
And when I was in medical school, there was actually a couple of failed elections trying to make medical marijuana legal in Florida before it passed in November of 2017. So I started educating myself because I wanted to be a responsible voter, but I also wanted to be a responsible physician. If there was an option for my patients, I needed to learn about it.
Oh, sure.
There was a defining moment I had after I left and I started practice, and I had a patient that had colon cancer, rectal cancer, actually. And he was in so much pain, he couldn't sit down, and he needed pain management. His mother, who was in her 80s, very feeble herself, was demanding that he takes pain medicine, but he refused because he knew he needed to say goodbye, and he couldn't be of the right mindset in order to say goodbye, and people were flying in. So it was like that evening I went home, started learning about the legalities. Could I even talk about this? And the law hadn't even passed yet. What is the science behind it? And I started realizing there is some science. There's really a lot of research about this,
absolutely.
and it is definitely a potential medicine. So my husband, Brett, who's also our CEO, he was really skeptical that this is just a path to recreational cannabis. And we actually attended a conference where we heard other patients speak about it, and it really just resonated with us. And it was there that I met my mentor, Dr. Dustin Sulak, who's considered an international cannabis expert. And so he's been my mentor and kind of guided me through the whole process. So that's kind of how I got started with it.